Hi everyone, this is Dr. Benny Shao, and this video is about what is syntonic phototherapy and how is it done. Syntonic phototherapy is the application of colored light as a way to directly create an effect on the autonomic nervous system. Now, the autonomic nervous system is your subconscious nervous system that just runs programmed. It controls things like your blood pressure, heart rate, things like that. So your subconscious nervous system or autonomic nervous system has two components. One is called the sympathetic and the other one is called the parasympathetic. Both are very important. They do opposite things in your body and they have very direct controls on how your eyes work. So let's talk about what these two systems do to your body. The sympathetic nervous system, which I call the emergency response system, when activated under stressful or dangerous conditions, your senses become heightened. So your sense of hearing, touch, vestibular system, sense of balance, vision, etc. all become extra sensitive in response to stress because the assumption is that you need to be able to detect danger more readily. You want your motor output to increase because you're running away. You're going to run away from danger or you're going to try to fight off an enemy. You want your thought processes to dumb down a little bit because, hey, if you're in danger, there's no time to think. You just react. And as far as what it does to the eyes, it makes your eyes focus further and turn outward in order to scan the horizon for potential danger. Now, your parasympathetic nervous system, which I will call the general maintenance system, which is also involved with digesting food, because that's important for maintaining your body. When activated, it causes just the opposite things to happen. It'll decrease your sensory alertness. It'll decrease motor output so that all that tension just dissipates, relaxes. And it will increase your ability to think higher order, more increased self-reflection, clarity of thought, because now that danger's over, you actually have time to think. And as far as what it does to the eyes, it enables the eyes to focus closer because, hey, if you're eating, you want to look at your food, which is not out there. It's right there in front of your nose. So now let's talk about what the different colors of syntonic filters do. When we look at the 7 colors of the rainbow, red, orange, yellow, green, blue, indigo, and violet, the warm end of the spectrum stimulate the sympathetic or fight or flight response. Conversely, the cool end of the spectrum, the blue, indigo, and violet, will actually stimulate the parasympathetic or calming response. Meanwhile, green acts as a balancer between the two systems. Now, we really need both systems to activate at the same time for day-to-day function. Whenever people have a binocular vision problem, and if there is a strong subconscious nervous system dysfunction that's happening that's responsible for it, by using different color combinations, we can influence how the nervous system is behaving in order to get the eyes to work together better. So as I explained earlier, your subconscious nervous system is involved with getting your eyes to either look closer or be able to aim further away. And so therefore, any imbalances in your autonomic nervous system can affect how your eyes work. And so when we utilize syntonic phototherapy, there's a couple of different ways to do it. The classic way to do it is to use a light box in a dark room. If you look at the photo in the upper right, you see a little lamp. And what it does is it's got a little slot in it where you can insert glass filters into it of the different colors. And so what you would do is you would sit in a dark room and basically just stare at the light for 20 minutes at a time. This works the most powerfully, but it does involve having the appropriate equipment. And the other way to do it, which doesn't work as powerfully but is still effective and it's more convenient, is wearing these light therapy goggles in ambient sunlight. That's the photo on the lower right. And so what we typically do is we dispense these light therapy goggles for patients to wear for 20 minutes at a time per day. And so while wearing them, you would be sitting outdoors looking at ambient sunlight. You want to be outside, look where the sunlight hits, where it's nice and bright, and just to do so for 20 minutes at a time. And the other way to do it, if it's not sunny, or if you don't want to sit outside, you could purchase a full spectrum LED light bulb and place that anywhere between 3 to 6 feet away from you, depending on how well you can tolerate the brightness. And again, just doing so indoors for 20 minutes per day. So how do we know that this light therapy works? Well, the fact is that the effect of the light therapy is more or less instantaneous. When I put the appropriate light filters in front of a patient's eyes, I can actually measure improved binocular function. For example, patients with double vision, when they are wearing the goggles that are helping them the most, the double vision actually gets diminished. And for my head injury patients, when I put the appropriate light filter on them and have them move their eyes around, head around, etc., they will immediately notice improvements in their dizziness, headache, nausea, and so forth. So what we typically do is we have the patients take the goggles home, use them daily, 20 minutes a day, and we follow up with them after a couple of weeks to make sure that they are actually getting better. The way we do so is by looking at how well the eyes work together to see if there's improved range of fusion, range of focus, etc. And when the time comes to change the filters, because people do change over time, when the time comes to change them, then we do so when the nervous system adjusts. And there, in a nutshell, is some information about what syntonic phototherapy is. If you'd like to get more information, you can visit the College of Syntonic Optometry at www.coslvision.org. You can also please view our YouTube link about the use of Syntonics in conjunction with something we call optometric multisensory training. Thank you.